back to my series of conversations that I'm having with leaders during this pandemic. It's been an incredible series. I think we've talked to dozens of leaders across the world, and I've learned a lot from it, and hopefully you're learning a lot from it too. I'm really excited to have my friend Steve Davis join today. Steve is somebody who you know well if you follow the DevX coverage around global health and so many other issues in development and humanitarian. He was the former CEO over at Path, only recently stepped down from that role and has had many, many roles around the world as a leader on global health issues, former director of social innovation at McKinsey, currently a senior strategist at the Gates Foundation and a distinguished fellow at the World Economic Forum, and somebody who I always turn to for his kind of big thinking, big ideas, and actually has a new book out, which I'm excited to learn more about, called Undercurrents, which puts out a bunch of those big ideas and talks about some of the big things shaping our world. So we'll get to all of that. But I thought we could start, Steve, just on where we are now with the pandemic, how you see it, given your experience dealing with vaccine development and with global health issues writ large, and other pandemics and epidemics like Ebola and HIV. So maybe just kind of starting big picture, how do you see where we are today with the pandemic?
Well, first of all, thanks, Raj, and it's always great to see you and you be on the DevX platform, which has been so important for all of us as we go through these challenging times. It's we're in this as a marathon. This is not the sprint we sort of imagined that maybe we could have had. I think that's true at the global level for sure, and certainly in the United States particularly. There's two sides of the story for sure. I mean, it's a balanced. I wouldn't say it's a balanced scorecard, but we see, there's some really positive things that I think we should talk about more often. I mean, the vaccine development efforts are unprecedented, and that's at a global level. And hopefully, we're going to see some really strong candidates, merge with actual vaccines in the next year and start, figuring out how to, do this unprecedented delivery of a
would you have ever
globally.
Thought, just really quick on that piece of good news, would you have ever thought it's possible to develop multiple candidates that are now in phase 3, in just 6 to 9 months? I mean, in your career,
I've been on vaccine company boards, and of course at Path we oversaw a very large portfolio of vaccines and got many into the hands of countries that needed them the most, and they are a long process. And so this is truly as unprecedented and as something we've never ever seen. And what's interesting, and of course there's been a lot of political debate about it, and we've certainly seen some of the concerns there, but the scientific community for the most part, or in the vaccine community, is pretty hardcore about, we're going to make sure this is a safe and effective vaccine. And so, I think it is pretty amazing. And, we'll have to learn from this, because what was we able to do? Was it simply the urgency and the level of investment and reprioritization, or were there things that we're learning that we could do to speed up other kinds of processes and development? So, but we'll see that. And of course, we're not just talking about vaccines coming from the United States and Europe, but we're seeing obviously in my new role, I'm tracking what's happening in China and other parts of the world. So
I should mention you're the interim country director for the Gates Foundation in China.
Yeah, I am. So we're looking at, some of the candidates there as well. And then the other thing I should mention, and this is sort of wearing a different hat, but from the digital, I also co-chair the World Health Organization's Digital Health Advisory Committee. And there we've seen an amazing amount of innovation during this tragic pandemic. And both in terms of course, we're all sort of experiencing digital in a new way because of the pandemic, but on so many fields. But in health and development, the commitment, the level of new investments, the number of new products and services. Now clearly that comes with a challenge. That's not terribly coherent. We don't have a particularly great mechanism to make sure those are getting to the poorest places in the world. I mean, there's a lot we have to work on. But I would also say it's been very exciting to see that happen. And I don't mean that in any way to diminish the horrors of the pandemic, sure. but that's a bit positive. On the other hand, yeah, go ahead.
Well, yeah, the other hand, I think we know well, the other hand of this, right? I mean, this has been such a behavioral science experiment in a way. and we failed in many aspects of that, right? And getting the
Completely.
ubiquitous mask wearing, the social distancing, and the other kind of getting global population level adoption of very simple tools that really we know work.
Yeah.
But maybe we can just stay for a
Yeah,
minute on
and that
vaccines.
we've, we've got a lot of recovery to do afterwards too, to figure out how do we go back to a place where science is less politicized, and how do we go back to a place where we can trust, build trust again in public health people and institutions, because it's going to be important. So
it is. Well, maybe we can just stay on vaccines for a second, because there's obviously so much interest. And I wonder, from your perch, you're connected to the WHO and, as you say, the Gates Foundation and elsewhere, this issue of vaccine nationalism, how worried do we need to actually be about it? I've been asking a lot of other global leaders like yourself, are you seeing that the deals being signed by the US government and the British government and others to try to, get a certain amount of vaccine for their population is going to directly lead to long gaps before the vaccine is available in lower income countries? Or do you think the COVAX facility at Gavi, that the other efforts being made at the global level are going to mitigate that, and that we are going to see kind of a global rollout at the same time? How do you see it developing?
Well, I think vaccine nationalism is so real, and it's not, and it's clearly playing out as we see all these bilateral efforts and deals being struck, and of course the U.S. not participating in COVAX is a critical challenge to that. That said, I don't see these as quite as mutually exclusive or binary as some people have portrayed them. That it's not a surprise that big, well-resourced countries are going to kind of figure out how to, meet their political objective of making sure they've affected their own country population, or managed it within their own country. And I am quite positive about the amount of momentum we're getting on COVAX, and more countries have come on board. China just came on board last week. Albeit, it will all depend on, the results of these phase 3 trials, and how much access and capability we really have to distribute at what point. Over time, I think we're going to be fine. It's just going to be a rugged year or two to figure out who's in first position and which vaccines are going to be up for distribution. And there's no question that the studies show that if we take it a very, really aggressive vaccine nationalist approach, that the pandemic will last longer. That taking a more global approach to the vaccine, the studies and models show, will actually curtail the pandemic faster globally, and even here in the United States and rich countries. So the science is saying don't do too much nationalism, but the politics are going to be what they are.
Yeah. Are there vaccines that you think are better when you look at the candidates that are at the kind of late stages, that make the most sense for developing countries? Because one of the concerns I've been hearing is the cold chain issues and the multiple doses, and that, again, you might be able to get past the vaccine nationalism. Maybe we'll have the right facilities to purchase vaccine, but can we deliver it in a way that's going to be effective in the lowest resource parts of the world? How are you seeing that issue developing?
Well, first of all, I'm want to be careful that I'm clear. I'm not, either a vaccinologist or close enough to know the ins and outs of different the science behind the various candidates in many ways. But I can say, from a broader strategic level, I do, I think that we're all, putting a lot of focus right now on what does this look like in terms of the distribution, and kind of making the leap of faith that we're going to have several candidates that are going to go, to become available. And I think seems to, the scientists say that that's looking more positive, although we're seen some setbacks. But so I think that there are definitely concerns about, you can even have a good one, but if you have the very, very the ones that have to keep in the very cold chain, that's going to be a big challenge. We already have that challenge with other vaccines in low resource settings and off the grid. And then, there are concerns about just the dosages, as you said, that if you have to keep going back. The other thing I think that's going to get confusing, honestly, is the people keep thinking there's going to be this one vaccine. And more likely than not, there's going to be several or multiples floating out there. And then you're going to get into this, but should I get, if I got that one, to cover my family, should I get this one to cover my grandmother? And that will be a luxury option, but that option might become available to many people, and that needs to get further thought through. But we're going to have to figure out how to do this with whatever vaccines we have available. And I think now there's a huge amount of conversation. I know I've been part of it, but a lot of people who are, focused on it more than I am and are smarter than me are spending a lot of time, thinking through the digital, the tracking, the tracing, the distribution channels, and not just how we're going to finance it, but how we're going to actually reach the last mile.
Yeah, and even things like the vials, the glass vials that are going to hold the vaccine. I mean, I don't think we've ever in human history had to produce so many of these things all at once, right? Billions and billions of
there's
doses.
some very interesting stuff that's going on. I mean, so you have to. Yeah, and I've been in a lot of vaccine factories or manufacturing facilities, and where you have to label those, and so it's a projection, it's a assembly line, and the label needs to get attached to the glass before you fill the vial, but you can't label it until you know what the regulators say you can put on the label. So it's some of the logistical issues. So right now, we are building up this manufacturing capability for the vials, but we can't do a lot of it until we have the label information right, and that's going to slow us down. So we're going to have to maybe come up with alternative models or skip ahead on some of these things, but it's a logistical challenge for sure.
And I think it's all these little things that are the reason why you hear a lot of the scientists say, hey, this is probably not going to be available to people for quite a bit longer than you might think. It's not about when it gets FDA approval. That's one important element, but that's not the end of the story.
Completely. And in fact, I think the and obviously that's got politicized as well, but the media, I think, we need to do a better job, as those in the media, now you're doing it, to make sure that we are clear that the date of there's a long gap, even in traditional vaccines. There's a long gap between an FDA approval or a regulatory sign off and access, and people hopefully will shorten that gap as we're shortening the development curve, but it's still going to be much out, and we're going to see some challenge. We just hope that it doesn't get, that this doesn't, the socioeconomic effects of reallocation, are what we really worry about.
Yeah, maybe we can just kind of take that broader aperture for a second, going past vaccines. You led one of the world's biggest global health NGOs. You know the space so well. What are some of the other things that are on your radar due to the pandemic? Of course, you got the secondary effects, economic recession, maybe other diseases that don't get the attention they deserve in some of the lower resource or middle income countries. What are you seeing kind of big picture as the after effects, the waves coming out of this pandemic, and how they're going to hit the populations we serve and care about, but even the institutions too, like the one you used to lead?
Yeah, well, I mean, I probably can't add much more to what you and your audience have been thinking about. I mean, this is not just one crisis, but this is layers of. We've got the health crisis, we've got the economic crisis. We're probably seeing an emergence of a humanitarian crisis in many instances, and all of those are happening at once. And what else is not a new idea, but it's just so impactful on the most vulnerable, poor, women. There's communities and groups that have been traditionally poorly served or are suffering the most. So I do keep coming back to maybe I'm an optimist by nature. My book, as you mentioned, is a lot about some of these currents that are undercurrents that are still quite positive. And I do feel like over the long haul, I think there are many people that aren't going to let this crisis go wasted, and that are rethinking sort of how do we're learning a lot about speeding up innovation. We're learning a lot about what's possible when you really, put a community in charge of its response, as opposed to waiting for the federal government, which didn't come through. We're learning a lot about, as I mentioned already earlier, the power of digital and data in this construct and how that can be reapplied. So I think there are multiple other waves or currents that we're also seeing that are quite exciting if we can wrestle them. Now, they're bigger topics. Again, like some people think, is this the moment we'll rethink shareholder capitalism? And because we've clearly failed over the last decade and many times. My worry there is on those big ones is because of our kind of need to turn on economies as fast as possible, and I don't see economies and health being as in opposition at all. But because of that need, we may skip over some of those things like environmental and labor rules, and so we may actually go backwards instead of forwards. But I think that there are other ways that we're going to skip ahead. I mean, look at online education. We've gained 10 years, even though it's gotten old and it's not perfect. We've just gained 10 years on consumer adoption, and that's an amazing thing.
Yeah, I wonder, you talked about not letting a crisis go to waste, that famous line. And I guess I'm surprised we haven't heard bigger ideas yet. Maybe they'll be coming, but bigger ideas yet about how do we want to reshape the response to the iniquities in the world based on coming out of this pandemic. Because the Gates Foundation published the Goalkeepers report showing they were set back by many years when it comes to achieving the SDGs. The inequalities in the world, the number of poor people living in extreme poverty is growing for the first time in a quarter century or something. I mean, we're looking at that and yet not sort of saying, hey, here's the big new way we're going to tackle this. Here's the big new idea. At least I'm not hearing much of that. Do you feel like in the rooms you're in, Zoom rooms probably, but the rooms that you're in, are you hearing more ambition than I am?
Yeah, I think there are those conversations. I'm not in the room where it happened all the time, but I think those are they are happening. I think they're happening in the context of we're barely keeping ahead of the one crisis before we can figure out the next crisis. So I think in some ways, maybe the reason we're not hearing them or feeling them as much as we could is people are just barely, managing through the last crisis. But that said, I do think there are people talking about, innovative financing, like how if the world goes, back too far, then what are ways, whether it's massive debt relief, whether it's different kinds of mechanisms to support communities around the world, how do we reshape that? I do think there's also been, a very, a challenging, this is challenging the social sector in big ways. I mean, a lot of NGOs are struggling, and it's of course in the US, it's also come along in a very difficult political year. So, funding that might go toward, philanthropy is not, or it's going very targeted. So, I think that's another place that we probably need to do some revisiting about, and there are conversations. Does it really expose the starvation cycle of some of these organizations that are critical to our response? And, honestly, the global health architecture discussion is, I be careful here, but, I hope that no one's sitting around in rooms and around the world and thinking, slapping each other on the back saying we're doing a great job as a global health community. We're getting through this. I work closely with a lot of the leaders and the leading institutions, and they are doing their massively great jobs doing it. But it's not to say we have an architecture that's worked really well, given the state of what we're in.
Just on that point, is your concern more about the architecture or more about the resources? In other words, if you, coming out of this pandemic, if you wanted to think about where we want the global health architecture to go, how it ought to look, is it broadly what we have today with more backing, with more resources, or is it really there's something different you think needs to be created?
I think it's both, in my own view. Not maybe in the minority opinion, but clearly there's a resourcing question. I mean, we've seen it. I was on the CSIS National Health Security Commission that, interestingly issued our report to Congress and the White House right before the the cases started to appear in the United States, and there was a call for, like, we cannot keep doing this. We'll worry about it when there's a crisis, and then we're not ready for the next crisis, and so there's certainly that, and we've seen a lot of that. But I actually think, decision making. I mean, obviously, I'm a big supporter of WHO and Dr. Tedros. It's a critical institution in this world. I think, they're navigating this, as deftly, but it does expose why more reform is needed, and we'll see what the independent panel says and others. But it's not just WHO. We have this whole set of players, and they're quite large institutions, that we're funding. I think a lot of overhead, honestly, and we probably need to take a look, like, how many more institutions should we be setting up, or how do we, shift them to the global south, or how do we, have a decision-making process that doesn't require this sort of protocol-driven model to make some really important science and political decisions. So I'm hopeful that we can have those conversations. We may be racing off to the next crisis too fast. I don't know.
Yeah, no, it's a fair point, and we have created in just the last decade or so. I mean, you've got Gavi, you've got CEPI, you've got the Global Fund, and a lot of the reason I think we created all these is because the traditional multilateral and bilateral institutions couldn't figure out a way to reform themselves. So they said, but one thing we can get together and we can create an alliance with the private sector on these very specific narrow vertical issues. And then those institutions were able to raise funds and able to go off to the races and get things done. But you're right. If you were starting with a blank sheet of paper looking at the problems in the world, maybe this isn't the way you would design it.
Well, and I mean, let's be fair. I mean, I was involved in some of those, and so I was at the table in Davos when we came up with CEPI and all that. But we're adding to the stack. We're not reprioritizing. We're not reshuffling the deck very much. We're not actually getting, we're not saying, okay, let's do this instead of that. We're just adding more and more, and what CEPI's doing right now is phenomenally important. Gavi's, made enormous contributions to the world. So I'm not making, it's not about them itself. It's just like how many, I hear probably every week I'm in a conversation where somebody says something and I'm accused of doing this as well. We need the Gavi of X, in the space I work in a lot. We need a Gavi for digital. We need a Gavi for this. And it's like, whoa, how many more, and it feels good to set up an institution, and you get, and there's a lot of reasons why people want to do that, and you feel you can sort of redesign. I was on a call this morning about the governance of a new institution in global health. And, I understand that the need for some of these new capabilities. I just wonder how we can shuffle the architecture a bit, where we don't keep adding on more and more rooms to the house, where, as opposed to thinking maybe we need to redesign the house a little bit.
Yeah, and I think sometimes it just feels easier, maybe is easier to set up a new institution rather than to reform an existing one. And that's the direction that we headed. In fact, I wrote a chapter of a book recently that's all about the proliferation of these public-private alliances and why that's probably going to be the model we still use in the future, because it is so much easier to set them up than it is to try to reform, for example, the United Nations, which, the Secretary General has gone through a big reform effort. How much has it actually landed in terms of real change? It's so tough, given, having so many stakeholders at the table at a place like the UN. We don't have that much time left, and I want to make sure we talk about your book, because I haven't read it yet. I'm excited to read it. And I was just looking through some of the big undercurrents that you outline in the book, which is really the way you framed it, around these 5 big undercurrents that are provocative. I mean, they suggest that the way we all think about doing development, health, humanitarian work is fundamentally shifting, which certainly aligns with my worldview. Maybe you can take us through some of the highlights on how you see those undercurrents changing our work.
Yeah, thanks, Raj. Yeah, the reason I ended up writing this book, so I teach at Stanford, and I've been in this space for a while, and I've been asked to advise on a lot of things, and I keep, I want to keep hearing, so many people, students, friends, neighbors and people in our sector are so discouraged by the trend, the headlines. The headlines are, whether it's on climate or pandemic or, and those are real and those are vital, and there's really good reason for that kind of outrage about all those. But what I was trying to think more about, but where are the underlying trend lines that, honestly have been pretty good in the world? I mean, as we talk a lot in our sector, at least up until COVID, about the progress we've made on, human well-being, on health and mortality and morbidity, et cetera, over the last 20, 30 years. And so I started thinking a lot more about those trend lines, which I started calling undercurrents. There's a bunch of water metaphors in the book that I won't get into. And, I'll be very summary, but they're ones like the world is reshaping itself and has been for a bit, from from the traditional way we talk about the pyramid to a diamond. And that's a huge sociographic, economic.
And you're talking about like sort of this idea that they're poorest people at the bottom of the pyramid, and then the richest people at the top.
Well, we're seeing two things. One, seeing the extreme between the rich and the poor has grown, but also, now the majority of people in the world actually live in the middle class, lower income middle class, and we don't have as many people in acute poverty, and they're just data will tell you that. Now, that doesn't mean everybody, we don't have a huge amount of pain and inequity and suffering, but it's actually now moved into kind of a squatty shaped diamond. And so that has a lot of things. It means we need to focus on poor communities everywhere, not just poor countries. It means that industry has a real role now as we address, the opportunity to work with social entrepreneurs and also with, lower income consumers become part of our solution as we would do that work. So I think it's a very powerful trend, and we need to keep building on that. I talk about the digital revolution. I talk about community and human-centered activism as a trend. I talk about the work on equity, which, we've always been working on, but we have a new moment now where I think it's an exciting macro trend that I focused a lot on the gender equity issues in our space, but also, there's obviously other categories. I certainly have experienced that as a gay activist, how we needed to, where we've come and what we can do more. And then the last trend I talk about is the trend toward more scaling of innovation, not just inventing. And there's a real evidence, as we've seen all this investment we've made over the last 20 years to come up with a lot of pilots and new ideas. And we've seen a lot of those new institutions that you talked about, energize the innovation community, but we haven't seen enough of it get to scale. And I think there's now a series of mechanisms and opportunities to take more innovation to scale. And to me, that's a great trend for what I call practical activists of all type to engage in.
Yeah, there's actually a community of practice of people who focus on scale, something we've covered at DevX quite a bit. And it's really fascinating to get into their worldview, which is to say, hey, we kind of know a few things that work, and we have some ideas about what it takes to get these things to scale, but often those aren't the sexiest things. And people do want to create that new institution, or the latest billionaire philanthropist says, well, I've got a real passion for this issue over here. When meanwhile, there are millions of lives to be saved or improved with, very direct interventions around nutrition or health or education in ways that we know work. So it's a really important undercurrent. I'm excited to see what you say about it.
And it's one that I kind of, it's the last one I mentioned, and then I feature what I call practical activists who've done this. But it's funny you say that, Raj, about this is what I teach at Stanford, scaling social innovation, and I talk a lot about this sort of, we glamorize and and give big prizes like MacArthur and Nobel prizes to people at the front of the value chain, which is great. We need inventors and brilliant people, and then we do a lot of focus on the last mile, and that's a very satisfying place to work. But it's this, as I call, the unsexy middle, that we just have to put more energy into. We have to spend more time. It's often invisible and difficult, and it's whether it's demand creation or regulatory stuff, or figuring out how do we get the label on that vial so it'll be ready. I mean, those are the nuts and bolts of scaling stuff up is really critical right now in the world.
It absolutely is.
So we're trying to make the middle sexy, is what I say.
Yeah, well, think about something like the meningitis A vaccine that you were involved in, right? And how many lives that saved. And it's not something often talked about. It's kind of forgotten because it is in that sort of unsexy middle, right? And it's about taking a big problem, actually affects a huge number of people, and doing the hard work to get it done. And it is a lot of the logistics, and it's a lot of the distribution, and it's a lot of the supply chain, and the things that, you know, we don't focus on enough. And that really
Well,
is
and
where the
I
action
think,
is.
COVID, boy, brought this to home. I mean, first of all, we had to scale things fast. And so, and was involved in a lot of the regional response as well, working with the local business community and political leaders in this part of the country. But, where suddenly people were like, whoa, this getting a PPE is a little harder than I thought. I mean, we've got to figure out the procurement rules, and we got to do this, and we got to, and then of course, we're paying a huge amount of attention as we started this conversation with who's going to come up with the first vaccine. But that's actually, I won't by any means say it's the simple thing, but boy, that is not the biggest focus. I mean, that's going to happen. The market's going to make sure somebody comes up with a great vaccine. The problem the global health and development community has is, how do we make sure that vaccine gets to the people that need it the most? And that's a lot of that unsexy middle work.
That's right. We work with a lot of big pharmaceutical companies around the world, and that's the realization that many of them have come to in the last decade or so, is they put all their great innovation and scientists behind these drugs, these vaccines, these solutions in their mind, and then they say, wait, how come it hasn't actually solved the problem?
Yeah.
Because of all these other steps that are required that may not be in their usual domain, but are in the domain of the global health NGOs and other players out there that have to be part of the solution. Listen, I'm excited to read the book. I'm excited to just spend some time with you. Thank you for doing this today, Steve. It's been way too long, and I really hope we can do it in person at some point.
Yeah,
when the situation allows it.
Okay.
Congratulations on everything you're doing, and thanks for taking the time to be part of this.
All right, thank you, and best of luck to you guys.
Thanks, and thanks to everybody who's been following this series. There's more to come. Send us your comments and views as we post this up on social, and appreciate you and appreciate everybody out there. Be well.